I'd like to welcome each of you to the virtual presentation of the surgery residency program at Riverside Methodist Hospital. I am Dr. Oscar Ruiz, the program director, and I am happy to share with you a bit about who we are, what we do, and why we feel this is an excellent place to train. At Riverside, you will build a solid surgical base, be allowed to expand your area of specific interest, and you will be prepared to be the best general surgeon you can possibly be. Here are some highlights of our program. We have 5 categorical positions and 4 preliminary positions. We are a very busy trauma program, enough to prepare a general surgeon well. We have 33 faculty members in a variety of specialties. Our quality mentorship program consists in assigning each faculty member to a resident for the first 2 years, and then the residents will select, depending on their area of interest, with whom they will continue. We have an inclusive wellness program, and we also provide the opportunity for clinical research, but also in basic science if needed. Our pass rate to the boards and fellowship placement is excellent, and each resident will be involved and or perform well above average number of surgical cases by the time of graduation. We belong to the Ohio Health System. It's a network of 12 hospitals, 200 ambulatory sites, hospice, home health. There is a lot of medical equipment and other health services that are available, and this is in over 47 Ohio counties. Riverside is an 1,100-bed hospital and is one of the busiest ERs in the state. Each of our interns will have the opportunity to do at least the following rotations. The only difference between the categorical and preliminary surgery residents, it is a couple of the rotations that they can be elect to do something that will allow them to continue with the next level of training. The preliminary surgery residents can also decide if they want to do exactly the same rotations of categorical, and that will be no problem. This is how our residents hone their skills in the surgical skill lab. As you can see, in the first year, they will be involved with the basic suturing, knot tying, lab simulation, FES, and robotic. The preliminary group will be included also in the same. As you advance, the levels will be more and more in a way of the skills, and this will make at the end the residents allowed for certifications in FLS and FES, and 4 of them, if they decided, will be also in robotics. Here you can see an example of our monthly didactic schedule. Each week we have conference in lung, our M&M, grand rounds, GI, colorectal, breast, tumor board, and textbook review with the monthly pediatric and journal club. We provide our residents with several off-campus rotations. Nationwide Children's Hospital for pediatrics at the level for PGY3, and they rotate for 3 months. Nationwide Children's is one of the best pediatric hospitals in the country, and we are very lucky to have an institution like that here in Columbus. Also in the PGY3 year, our residents rotate at Ohio State University in the transplant service. We have been very lucky also to have an excellent relation with Ohio State for several years, and we share with them in the surgery program the training of our residents for mock orals. We go there from the PGY3 to PGY5 in the spring, and they come with us here to do practice or exams in the fall. To complement our outpatient surgery experience, our PGY2 level residents rotate in the VA Ambulatory Care Center. This is an institution that sees daily approximately 1,200 patients. Our clinical surgery service is where the chief resident runs the service, acquiring clinical, surgical, and administrative experience. This is a unique rotation, and very few places in the country can provide this experience. Our program is very lucky. There is several outpatient surgery centers that belong to Ohio Health and also to Riverside. There is one in campus, but mainly they go with our attendings to Knightsbridge Surgery Center. There is a significant amount of bread and butter cases that provide and complement their surgical skills. Our residents have access to the Center for Medical Education and Innovation. The CME&I is the first of its kind in the state of Ohio. This state-of-the-art facility greatly enhances patient safety and the quality of residents' training by spending time in different labs: microvascular, laparoscopy, robotic, minimally invasive cath lab, clinical and exam rooms, and also conference rooms. This is some examples of how the residents train, and this facility also it is verified and is part of the accreditation of simulation skill labs by the American College of Surgeons. Our new medical education conference center includes upgraded AV technology, new computer technology lab, and conference rooms for safe patient hands-offs and also daily table rounds. We are very proud of our general surgery graduates, and I would like to offer in our next two slides a quick view of the fellowship obtained by those who choose to specialize further from the last 5 graduating classes. As you can see, they have been placed in very competitive fellowships, and if we go back in the previous 5 years, and even the previous 5 years, and traditionally have been consistently doing very well with jobs and fellowships. Our preliminary group of residents also have an excellent placement after the training. Now I would like to talk to you a little bit about Columbus. Some of you have been rotating here as students, so you are from here, but the majority of you may be not familiar with Columbus. It is the capital of Ohio. It is located with an easy driving distance of a lot of good places: lakes, the Hocking Hills, cities like Cleveland, Cincinnati, Pittsburgh, Indianapolis, Detroit, some of them in Kentucky. It is a good place, centrally located. It is a rapidly growing Midwestern city and offers just here a world-class entertainment, cultural events, diversity, and security. If you have a family, it is a very safe place to be, and excellent school systems for the kids. I am sure you will feel that very welcome here. Again, for your interest in our general and preliminary surgery programs here at Riverside Methodist Hospital, and we are looking forward to meeting you soon.